Hi, this is Caitlin Strakowski, and this is a community analysis on the city of Fort Lauderdale. The city of Fort Lauderdale dates back 5,000 years ago when the people of the Tequesta and the Glades culture inhabited the area. They were most likely drawn to the New River, which provided sustenance and life for them. In 1911, Fort Lauderdale became an incorporated city, which now includes 33 miles of land and 30 towns. It is currently the 7th largest city in Florida and is located between Miami and West Palm Beach. Fort Lauderdale is surrounded by the New River and the Atlantic Ocean. The map shown highlights the boundaries of the city. Housing in Fort Lauderdale is extremely diverse, and these photos are just a sample of what you may find here. Everywhere you look, you'll see beautiful high-rise condos and apartment buildings, as well as many large, extravagant single-family homes and more conservative and traditional single-family homes. One of the most interesting things about Fort Lauderdale is that you will also see people on the New River who live on their sailboats. These are just a few pictures of what you may expect to see in Fort Lauderdale, and is a very good depiction of what's present here. Although Fort Lauderdale is prosperous and has beautiful houses and condos all over the city, there are many less fortunate people who reside here. The city of Fort Lauderdale has numerous resources for these people. Covenant House, pictured to the left, is a place for at-risk youth and children to obtain housing and other resources so that they aren't having to live on the streets. The Housing Authority of the City of Fort Lauderdale, pictured to the right, helps homeless individuals find single or multifamily housing that is affordable through tax credits and Section 8 programs. Broward Partnership for the Homeless, Incorporated, pictured on the bottom of the page, is one of the biggest agencies for helping reduce homelessness through housing and improving self-sufficiency. There are many programs throughout Fort Lauderdale that commit their resources to serving this community, and overall they do a phenomenal job. Due to its dense population and diversity, Fort Lauderdale offers many options for worship and education. Places of worship are available for all different denominations, and most of these churches, temples, and other places of worship also offer services to the community. The Broward County Library System has libraries in the city of Fort Lauderdale, and there are specialty libraries located here, such as the Broward County Law Library and the African American Research Library and Cultural Center. Schools are also readily available thanks to the Broward County school system and private schools, which are generally affiliated with the local churches and temples. Transportation in Fort Lauderdale is easy to come by, and there are many options including Broward County bus transit, taxis, Uber, Lyft, and private vehicles via 6 major highways, one of which goes directly through the city. Healthcare is also easily accessible all around the city of Fort Lauderdale, including a Level 1 trauma center located in the center of the downtown area, along with many clinics and urgent care centers. The population in Fort Lauderdale is 165,578, with a population density of 4,761.1 people per square mile. It is 52.5% Caucasian, 31% Black and African American, and 13.7% Hispanic and Latino. The population increases by a large number each day, with an influx of people into the city of Fort Lauderdale for work and tourism. The percentage of unemployment, poverty levels, and number of people receiving assistance from the government are higher than the county or the state, and more resources are necessary to handle the increase in population during peak hours and tourist season, increasing the burden on the city of Fort Lauderdale. Education levels of people over 25 are below county and state numbers, except for those who hold associate and bachelor's degrees. Of the top 10 most communicable diseases in Fort Lauderdale, 6 are sexually transmitted diseases, including chlamydia, gonorrhea, syphilis, HIV, hepatitis B, and AIDS. There's a higher incidence of HIV seen in the African American and Black community. People who are HIV positive have a higher incidence of other STDs. Miami has a very similar racial population breakdown, and similar STDs are prevalent there as well. Fort Lauderdale does a phenomenal job at providing high-quality health care affordably to all residents. Broward Health Medical Center provides charity health care and affordable options for people who do not have insurance, including their own health plan. There are many primary and specialty clinics affiliated with the hospital to allow all patients the opportunity to receive health care. There are many pharmacies located in Fort Lauderdale, one of which is called AIDS Healthcare Foundation Pharmacy that has a thrift store attached called Out of the Closet. This is pictured on the bottom left-hand corner. Their proceeds are donated to funding AIDS research and helping people pay for their medications. Overall, Fort Lauderdale has seen the need for its residents and goes above and beyond when providing access to high-quality, affordable health care. The first Healthy People 2020 objective that is applicable to the health of the community of Fort Lauderdale is STD-1, to reduce the proportion of adolescents and young adults with chlamydia trachomatis infections. Chlamydia is the #1 communicable disease in Fort Lauderdale at a rate of 430.7 per 100,000 people. The second objective is DS-11, to increase the proportion of adults with hypertension who are taking prescribed medications to lower their blood pressure. Cardiac disease is the #1 cause of death in Fort Lauderdale at 25.7% of all deaths, and management of hypertension, especially among at-risk populations, such as African Americans, can reduce the rate of death. The third objective is C1, reduce the overall cancer death rate. Cancer is the second cause of death for this community at 23.6% of deaths, and is the reason for choosing this objective. Fort Lauderdale has a very well-developed sanitation system, including 2 water treatment plants that can manage 82 million gallons of water per day, and a sewage system that is managed by highly trained technicians, 24 hours a day, 7 days a week, 365 days a year. Hazardous and solid waste are handled properly through private companies and receptacles for disposal in virtually every public area. The American Lung Association gave Fort Lauderdale a grade of B for its air quality, which includes ozone quality and short-term particle pollution, on the State of the Air report in 2014. Currently, Fort Lauderdale is a part of the Zika crisis, and measures are being taken to reduce exposure through aerial mosquito control. Fort Lauderdale also has plans in place for most vector and pest problems should they arise. Fort Lauderdale has done an exceptional job of providing plenty of activities to choose from. It has over 70 parks, multiple pools and aquatic centers, and recreational activities for people of all ages. Most of these facilities are managed by the city and have trained staff at all times to ensure the safety of its residents. Fire rescue and EMS programs include 11 fire stations. They respond to 54,387 incidents a year and have a response time of less than 6 minutes 90% of the time. They have 260 licensed paramedics and 67 licensed EMTs, and have specialty teams including dive rescue, tactical response team, and hazardous materials response teams. The police department here handles 200,000 calls to service annually. Response time is 4 minutes 28 seconds for emergency calls. They have 515 sworn officers, and programs such as Special Weapons and Tactics, also known as SWAT, and K-9 police dogs. The government in Fort Lauderdale operates using a commission manager form of government and consists of a mayor, vice mayor, 4 commissioners, a city manager that also serves as the chief executive officer. The commission is responsible for setting policy, making resolutions, and passing ordinances They are also responsible for making appointments to the advisory boards and committees. The city manager is appointed and reports to the city commission and serves as the chief executive officer. They are responsible for daily operations and carrying out policies enacted by the commission. Fort Lauderdale shows dedication to maintaining the safety and security of the residents by allocating 51% of its budget to police and fire services. However, only 3.3% of the funds were allocated to development of sustainable development, which could reduce energy usage and costs, therefore increasing the quality of life for its residents. 57.6% of funding sources come from property taxes and taxes alone. Overall community needs that have been prioritized are: number 1, decreased substance abuse and promotion of rehab programs. Heroin and fentanyl are on the rise, along with overdoses and potential fatalities. Number 2 is education and prevention of STDs and HIV exposure and transmission, including Zika. Zika virus is a newer problem right now that residents need education on, and Fort Lauderdale has a very high incidence of STDs. Number 3 is education and prevention of cardiac disease, as this is the number 1 cause of death in Fort Lauderdale. Number 4 is decreasing the number of unemployed people, because the unemployed rate is higher than the state or the county. And number 5 is promoting economic self-sufficiency, which would help decrease the burden on the government, allowing resources to be allocated somewhere else. Number 6 is continuing assistance of the less fortunate and homeless individuals, which Fort Lauderdale already does a very good job of and should continue. The global community issue chosen is substance abuse, especially in regards to heroin and fentanyl. Fort Lauderdale experiences as many as 6 deaths per week from heroin and synthetic opioids in recent months. Broward County enacted a recent opiate action plan put together by addiction specialists and law enforcement officers, and is being called a silent killer. Many rescue trucks and police officers are carrying intranasal Narcan, and Narcan is now being sold over the counter in Broward County. Other countries are also experiencing this epidemic. In 2005, at least 1 Australian citizen died every day. Heroin is the number 1 choice for intravenous drug users in Australia, and now Australia is considering programs for peer-administered Narcan for the reversal of the drug intranasally. I hope you enjoyed this presentation. Thank you for listening.